emergency planner, you make plans to meet the functional needs of a wide variety of people in case of an emergency. One of those groups of people, people with disabilities, constitutes a large portion of the general population. In fact, roughly 1 in 5 Americans has some kind of disability. You are sure to have people with disabilities in your jurisdiction as an emergency planner. People with disabilities may have functional needs that will require accommodations during and after emergency response. In 2012, an apartment fire broke out in a HUD apartment complex in Xenia, Ohio that displaced 67 people, the majority of whom had functional needs or were senior citizens. Following the disaster, confusion about what agencies were responsible for assisting with what services slowed down disaster response and delayed essential assistance from all parties. As a result, the majority of the apartment inhabitants were left without homes for several months. With careful and inclusive planning and coordination of agencies, situations like the Xenia apartment fire can be avoided. The purpose of this training is to provide emergency planners with information and best practices that will ensure the safety of people with disabilities during emergency events. Special consideration will be given to the importance of including people with disabilities and disability organizations in the planning process. Instructions for obtaining a number of resources, including a list of statewide and regional disability organizations, are provided at the end of this training. This training is divided into 5 sections. The first section is an introduction to disability. The second is communication and notification. The third section is evacuation and transportation. The fourth is sheltering and recovery, and the fifth section is inclusive planning for disaster mitigation and response. The learning objectives for this training include the following. The first objective is to highlight portions of a federal law called the Americans with Disabilities Act, or ADA of 1990, that are relevant for emergency planners. The ADA states that reasonable accommodations must be provided when necessary for people with disabilities to receive the same level of services as the general population. The second objective is to provide emergency planners with information and methods that will help to ensure effective and appropriate communication and notification in reaching people with disabilities during emergencies. The third objective is to identify groups of people who may need special consideration with regard to transportation and evacuation, and to identify best practices for addressing those needs. These will include transporting mobility aids, assistive technology devices, and medical equipment. The fourth objective is to provide emergency planners with information and methods that will ensure independence for people with disabilities in emergency shelters and in the recovery process. The last objective is to provide emergency planners with guidance on making the emergency planning process inclusive to individuals with disabilities as well as disability organizations. Introduction to disability. Disability is not an uncommon occurrence. In fact, 54 million Americans have some kind of disability. As mentioned earlier, that is 1 in 5 people in the United States. Additionally, 97% of people with disabilities live in the general population, and many of these people have functional needs, which will require special considerations in emergency situations. To ensure that people with disabilities are receiving the same quality of services as the general population, it is important to incorporate people with disabilities and organizations that serve people with disabilities into the emergency planning process to provide appropriate accommodations and services. These accommodations can be crucial to ensuring that people with disabilities are able to remain safe during an emergency situation and are able to return to their homes quickly following a disaster. The rights of people with disabilities to these accommodations are protected by the ADA, or Americans with Disabilities Act of 1990. The ADA of 1990 defines a disability as a physical or mental impairment that substantially limits one or more of the major life activities of an individual, a record of such impairment, or being regarded as having such impairment. This is a functional definition. In other words, the ADA does not list specific impairments. Rather, the determination of whether or not a person has a disability depends on how the impairment impacts their functioning. Diagnoses and labels such as cerebral palsy, multiple sclerosis, and head injury are not relevant when helping someone in an emergency situation. What is important is the functional needs that must be addressed. It is also important to note that many disabilities are not apparent. Examples of hidden disabilities include mental health disorders, asthma, hearing loss, or deafness. and some intellectual disabilities. While you may not work directly with individuals with disabilities as an emergency planner, the partnerships you form with people with disabilities and disability organizations will help you to more safely and effectively assist everyone in your community in the event of an emergency. Also, during the planning process, you may have the opportunity to provide first responders with key information about effectively serving people with disabilities. Here are a few general guidelines to keep in mind when working with people with disabilities. Recognize that people with disabilities are extremely diverse. Do not apply stereotypes to an individual or make assumptions about a person's abilities. Do not assume that people with disabilities have poor judgment or do not know what is best for them. Use person-first language. Do not label a person by their disability or use negative terminology. For example, do not say the wheelchair-bound person. Instead say the person using a wheelchair. One notable exception is the deaf community. People who are deaf prefer to be referred to as deaf.
With people-first language, you want to keep in mind that by focusing on the person and talking about the person first versus the disability, you're creating a better communication environment where you then can help with the problem. You can then help with the situation.
Whenever possible, ask people with disabilities how you may best help them. The best way for you to do this as an emergency planner is to include people with disabilities and disability organizations in your training drills and planning meetings. Instruct your partners and first responders to communicate respectfully and openly when helping people with disabilities in an emergency. It is appropriate to do the following. Explain who you are, why you are there, and what is going to happen. Take time to understand what the person may be trying to communicate. Do not dismiss them or pretend to understand what they are saying. Communicate directly with people with disabilities rather than immediately addressing caregivers, interpreters, or companions.
I'm a mother of an adult with autism. She is 22. And then I'm also a nurse, and I've been a nurse for 28 years. Because she's not verbal, people equate that instantly with lack of intelligence. Even though she's not making eye contact with you and she's not really appearing to listen to you, she hears everything and she understands everything. Well, what typically happens in the situations is they talk to me, they don't talk to her. They don't explain to her what's happening. They need to explain to her, and I've seen that when the EMS comes into the ER a lot. With people with disabilities, they talk around them. They talk to the caregiver, but they don't talk to the child or the adult. A lot of times they do understand, and you need to take the time to explain to them what's going on, because even if they're not really absorbing it, they get the tone.
Be aware of your personal biases and the tone of your voice. Treat adults as adults and children as children. Ask the person how you can best help them. For people with cognitive impairments or communication barriers, keep messages simple and direct. The CMIST Functional Needs Framework. One model that offers a good approach for planners seeking to address the wide range of functional needs that may be present in their community is called the CMIST Framework. You may already be familiar with CMIST, as the Federal Emergency Management Agency advocates a shift from special needs to a focus on functional needs. The functional needs included in the CMIST framework are communication, maintaining health, independence, safety support services and self-determination, and transportation. Communication considers those with varying communication needs and addresses them to ensure people can get and understand information they need. Maintaining health is managing all medical concerns and health conditions. Independence is focused on enabling individuals to maintain the same level of independent functioning as they had before an emergency situation by ensuring equipment, supplies, or appropriate accommodations are available. Safety support services and self-determination ensures individuals have the support they need to maintain a controlled and safe environment for everyone. Lastly, transportation considers all the barriers an individual may face in having mobility during an emergency situation. Pregnant women, the elderly, people without reliable transportation, and people with disabilities may all be considered to have functional needs. Although this training is specific to people with disabilities, you may wish to keep in mind other groups of people with functional needs as we go along. Communication and notification. Getting accurate and important information to people in a timely manner is crucial to protecting lives. Communication and notification access means providing information in ways that are understood, usable, and trusted by the community. Emergency communications should be fully accessible to everyone. This includes messages conveyed by call centers, press conferences, radio, television, social media, and websites. This also includes emergency preparedness materials. Strive to keep your message simple, not higher than a third-grade reading level. To ensure clarity of a message, messages should be tested by diverse users such as children, people with cognitive disabilities, and people with communication barriers.
I suggest maybe making your English a little bit simpler or easier to read. So don't use a lot of words or sophisticated words or English grammar. Make it a little bit easier to understand the meaning at a glance.
People who are deaf or hard of hearing, have a speech disorder, or have limited English proficiency are considered to have communication barriers. People with communication barriers may wish to communicate orally through writing with the use of an interpreter, by reading lips, or by using nonverbal hand gestures. Individuals with the same type of communication barrier can have very different communication abilities and preferences. For example, while one deaf person may communicate orally and through reading lips, another deaf person may communicate primarily through sign language. Therefore, it is best to notify the public about emergencies through a variety of media. This can include using the telephone, text messages, email, social media, your agency's website, loudspeakers, pictograms, auto-dialed teletypewriter or TTY messages, pagers, video relays, radio alerts, in-person notification, and television alerts and press conferences. Repeat your message multiple times. Communication redundancy will allow your message to be received by as many people as possible, as quickly as possible. It is also important to stay up to date on technology advances such as software and hardware updates, which can have the potential to enhance and expand your communication capabilities.
When I watch television, captions aren't added. They will broadcast emergency alerts, but the television station never adds captioning to the alert. I remember about 5-6 years ago, I was sitting at home watching television and it was raining very hard, and I saw on the screen emergency alert. And later I called the local television station to see if they would consider adding captionings to their alerts, but I never received a call back from my local television station. I think maybe we should start a promotion to encourage the television station to add captionings. I'm not aware of any other technical device that would help me know if there's an emergency situation happening in my neighborhood, in my area.
Planners should identify providers of sign language interpretation and real-time captioning services ahead of time in order to ensure that press conferences held during an emergency are accessible to people with communication barriers. Live ASL interpretation during emergency announcements on television should also be considered. ASL is a distinct language, and deaf people who use ASL as their primary language may not be fluent in written English, so captioning may not be the most accessible option. If you are utilizing an interpreter, be sure to instruct your camera operator to keep the interpreter in the shot. Sign language interpretation services are generally provided for a fee by private agencies or individuals, and can also be accessed via video phone. It is also important to make a plan for on-the-ground evacuation communication when the power is out. Megaphones will not work for the deaf, so other methods of on-the-ground notification, such as shining bright flashlights into house windows, should be used. Should you need to communicate directly with a person with a communication barrier, keep in mind the following guidelines. When using an interpreter, remember to address your comments, questions, and concerns directly to the person with whom you are communicating, not the interpreter. People with language barriers may have family members willing to translate for them. However, family members or friends should be used to help translate only as a last resort in an emergency situation. Using loved ones to interpret can be problematic because critical information may be lost in translation, or the family member may not understand your instructions or the terminology you are using. If you are unable to understand someone with a speech impairment, it is okay to say, "I don't understand. Please repeat that," or "Can you say it in another way?"
I would just suggest that if you're talking to someone like myself who you're having a hard time understanding, just say, "Hey, can you say that again?" Or "I didn't quite get that," or let them know that you don't understand them. But don't just sit there and say, okay, yeah, don't do that, because that's very irritating, and you might be saying, to something that you don't want to say, to, so.
Other tools to facilitate communication include pencil and paper, any mobile device such as a cell phone. Phones can be used to communicate through typing or through mobile apps designed to facilitate communication. Communication boards, these are large laminated sheets with pictures. Emergency notifications should also be accessible to people who are blind or have low vision. Any information shown on a television screen should be accompanied by a verbal description so people with visual impairments can access the information. For example, refrain from simply referring to the phone number on your screen. Rather, speak the actual phone number. When testing notification systems, planners should involve disability organizations and people with disabilities in the tests. This can involve all phases of testing: planning, execution, evaluating the results, and making ongoing procedural and equipment changes. The involvement of people with disabilities in the planning process can help to ensure emergency messages are effective and accessible. Transportation and evacuation. Safe and efficient transportation and evacuation are crucial during an emergency situation. By including people with disabilities in training exercises and planning meetings, emergency planners can better prepare for situations that might arise during an evacuation.
Through the contacts we had built up with the committee we did a full-scale shelter exercise. And in that, through those contacts, we brought in not simulated people, but we brought in real people with disabilities. We had deaf, we had blind, we had Spanish speaking. We were able to use American Sign Language interpreters, Spanish interpreters to assist the Red Cross with registration. We invoked transportation to get those folks that didn't have transportation to the shelter environment, folks in wheelchairs, a lot of medical, mental, and medication issues. Through those relationships we had, that was a great opportunity. It was a wonderful learning experience for the people that had the disabilities, for them to come in and see and experience what a shelter might be like, and of course for us to learn what deficiencies we had in those areas.
In order to maintain independence during an evacuation, many people with disabilities require certain mobility aids and assistive technology devices. This may entail the transportation of such things as wheelchairs, scooters, oxygen tanks, durable medical equipment, laptops, tablets, or other technology, as well as service animals. Service animals. Some people with disabilities utilize service animals. Knowing how to handle service animals in emergency situations will help to ensure the safety of people with disabilities and their service animals. Proper treatment of service animals will also allow first responders, healthcare workers, and shelter staff to do their jobs more efficiently. A service animal is a dog that is individually trained to do work or perform tasks for a person with a disability. Keep in mind that people with visual impairments are not the only people who use service dogs. For example, service dogs may be used to alert a person with significant hearing loss when a sound occurs, or to assist a person with epilepsy during a seizure. Under the ADA, state and local governments, businesses, and nonprofit organizations that serve the public generally must allow service animals to accompany people with disabilities in all areas of the facility where the public is normally allowed to go, including shelters. In short, where the handler goes, the animal goes. This includes public vehicles and shelters. Under the ADA, service animals must be harnessed, leashed, or tethered unless these devices interfere with the service animal's work, or the individual's disability prevents using these devices. In that case, the individual must maintain control of the animal through voice, signal, or other effective controls. Only dogs are recognized as service animals under Titles 2 and 3 of the ADA. The work a dog has been trained to do must be directly related to the person's disability. Dogs whose sole function is to provide comfort or emotional support do not qualify as service animals under the ADA. However, a service animal may perform work such as reminding a person with mental illness to take prescribed medications, or calming a person with post-traumatic stress disorder during an anxiety attack, and these animals are protected by the ADA.
So how can you tell if a person's dog is a service animal or a pet? When you arrive at a scene, scan for a harness or vest that may be hanging near a door. To find out if a dog is a service animal, the law permits you to ask these two questions only. Do you need the animal because of a disability? What tasks related to your disability has the animal been trained to do? If the person can answer these questions, then it is a service animal. When in doubt, take the person's word for it and treat the animal as a service animal.
Service animals are extremely valuable to their owners. Dogs that are used for service work are selected based on their stable temperament. They do not provide protection and therefore should not be considered a threat by planners or first responders.
Most of the really good service animals trained at solid facilities, trained by people who really know the craft, most of those animals are not going to be aggressive. If you run into an aggressive, particularly a guide dog, that's somewhat of a novelty or an anomaly, really. By and large, the first responder has nothing to be afraid of.
It is recommended that service dogs be cared for in the way you might care for a small child. A service dog and its handler should not be separated except in rare cases. A service dog should never be abandoned at the scene of an emergency or simply taken to an animal shelter. If a service animal is injured, only a responsible official or someone known by the handler should transport the dog to a veterinary facility of the handler's choosing. If that isn't possible, the dog should be taken to a veterinary facility where emergency care and boarding have been previously arranged by planners or first responders. Arrangements to reunite the pair should be made as soon as possible. If the handler is unable to communicate, you may be able to find out information about the dog by scanning its microchip.
And most of these service animals, again from the truly good schools, most of them will include a microchip implanted in the dog. And at least it gives the address of the school who owns the dog, if not the actual handler. And so you may be able to call the school itself, and it has staff on hand who can advise you as to the best way to deal with the dog until things can sort of normalize out or smooth out if they're going to or whatever.
Mobility impairments. Mobility impairment refers to the inability of a person to use one or more of his or her extremities or a lack of strength to walk, grasp, or lift objects. This can be caused by a number of factors and could be due to a physical disability, morbid obesity, bariatric issues, or prolonged injury. A person with a mobility impairment may use a walker, wheelchair, crutches, or other assistive device. Over the past 20 years, the prevalence of mobility impairments due to obesity has increased, as obesity rates have doubled in adults and tripled in teenagers. It is important to understand that the issues involved in weight are a complex blend of genetic, environmental, and psychological factors. Unconscious bias against this population may affect the quality of services they receive. Ask yourself, do I make assumptions about character or intelligence based on weight? If you wish to assess your own prejudices about people who are obese, Self-assessment worksheets are available from the Rudd Center for Food Policy and Obesity at Yale University. These worksheets are designed to help healthcare providers recognize their own societal and personal biases against overweight people. Though you may not work directly with evacuees, here are a few important guidelines regarding the transportation of people with mobility impairments that you may wish to incorporate in your plan and convey to your partners and first responders. If the person is conscious, ask them about how they have been transported in the past or how they would prefer to be lifted. Whenever possible, ask the person before removing them from a wheelchair. Most people consider their wheelchair to be an extension of their body, so it is important to ask how you can best help.
There's another time where I got a new car and it took me almost 20 minutes to get the chair in the car. Well, a guy comes up. He doesn't talk to me, nothing. He took the wheelchair out of the car. I said, what are you doing? He said, I thought you needed help getting the chair out of the car. I said, dude, it took me 20 minutes to get the chair in the car. So my whole point is that if you want to help, you have to ask first. My wheelchair is a part of me. I don't want it to. If you want to help me, just say, what can I do to make it easier for you?
In some situations, it could be harmful to remove a person from their wheelchair because of special supports provided by the chair. If you do remove an individual from a wheelchair to transport them, the chair should be brought to the shelter, hospital, or wherever the person has been taken. Wheelchairs and other mobility devices are expensive and very valuable to the people who use them. Take care not to lose or damage them in transport. Do not assume that a person in a wheelchair has no independent mobility. They may only need the chair for long distances due to weakness or balance issues. You may ask the person what their limitations are and if they are able to stand briefly to move to a cot, for example. Evacuating people who use wheelchairs or who have other mobility impairments involves the use of accessible transportation. To ensure emergency evacuation plans include vehicles that are accessible to people with disabilities, emergency planners should partner with a variety of transportation providers, including public transit, paratransit, school bus, and private sector transportation resources. As you plan for emergency evacuations, pay special attention to residential care facilities that serve people with disabilities and the elderly. These facilities frequently rely on the same transportation resources to evacuate their clients. While this may work for a facility evacuation, it will not work in a large-scale event. Emergency planners should meet with representatives from the residential care facilities to review plans and discuss suggestions for improvement. A centralized database for these facilities can also catch resource duplication. As you update your emergency plan, consider the following questions regarding transportation. A list of these questions can be found on our resource page at go.osu.edu/emergencyplanners. Are multiple entities dependent on the same evacuation resources? Do evacuation plans address both accessible transportation needs and a realistic number of alternative resources? How will people with disabilities be transported from schools, neighborhoods, medical facilities, and nursing facilities? Do first responders know the disability and aging transit providers? Do you know where people with disabilities access the transit system? Are written agreements in place with neighboring transportation jurisdictions to assist in emergencies? During non-operational hours, how quickly can transportation providers respond? Are wheelchair-accessible vehicles and trained drivers immediately available during evacuations? Are personal care assistants available to assist people during evacuation? Do drills and training exercises involve disability service providers and people with disabilities? Emergency planners should also encourage citizens with disabilities to make their own plan and backup plans for emergency evacuations. Generally, people who have the lowest levels of mobility should have the greatest number of backup plans. Once people with disabilities have been evacuated and placed in emergency shelters, they should also be provided with accessible transportation to travel to and from work, health services, recovery services, or outings offered for sheltered residents. Cognitive impairments. Emergency situations can be especially upsetting to people with cognitive impairments, as these individuals are often more vulnerable to the negative effects of stress. Some, although not all individuals with cognitive impairments, may also have safety support needs in emergency situations. Cognitive impairments can be associated with a number of different conditions, including autism spectrum disorder, intellectual disabilities, cerebral palsy, pre-existing traumatic brain injuries, dementia, and mental illness.
And safety is a huge issue because she does not have a sense of danger. If she left a room, she would wander around, especially when she doesn't know where she's at. She could be out of the building on the street and have no clue that she could be hit by a car.
In particular, people with mental illness face a great deal of social stigma, yet mental illness is more common than many realize. In 2009, almost 20% of American adults had a mental illness, which can involve such symptoms as changes in mood, personality or personal habits, social withdrawal, confusion about reality, extreme sadness, or anxiety. Keep in mind that mental illnesses are simply illnesses of the brain, just like any other type of physical illness. A mental illness does not reflect a character flaw on the part of the individual, nor does it indicate a deficit in intelligence or a propensity for violence. During an evacuation, some people with disabilities may be reluctant to leave their homes for a number of reasons. People with cognitive impairments, such as mental illness or dementia, may be afraid to leave their homes due to a belief that they will be placed in a nursing home instead of being returned to their homes after the disaster. People with other types of disabilities may have fears about how they will maintain their independence outside of the home, which may be equipped with special accessibility features. Other people may have emotional support or companion animals which they will be reluctant to abandon. Although these animals are not protected by the ADA, they provide important emotional support for some people with disabilities. Special consideration should be given to making arrangements that would allow the individual to evacuate with their emotional support animal. If it is not possible for the animal to accompany the individual to a shelter, arrangements should be made with local kennels and animal shelters in advance to ensure that the animal will be in a safe location during the emergency and reunited with their owner as soon as possible. As an emergency planner, you may facilitate the evacuation process by instructing your partners and first responders to be sympathetic to individuals experiencing these fears, to reassure individuals that any relocation is temporary, and to take the appropriate planning steps to ensure that companion and other animals are accounted for during evacuations and emergencies. Sheltering and recovery. Emergency plans should contain provisions for people with disabilities in emergency shelters. If a person with a disability is able to live independently at home, the goal of the shelter should be to maintain that person's same level of independence. General population shelters must meet ADA requirements. Shelters should have accessible entrances, access routes, restrooms, shower facilities, and dining areas. To help ensure a shelter is accessible, consider partnering and entering into agreements with people with disabilities or representatives from disability organizations. These partners can advise about changes that should be made in order to make facilities accessible, as well as provide guidance about where to locate a variety of community resources. Include in your plans the methods you have identified for locating, procuring, and storing necessary medications, consumable medical supplies, and durable medical equipment that may be needed during an emergency situation. The ADA also offers guidance and checklists to help you assess the accessibility of shelters. See the resources page on our website for contact information. Standard cots used in shelters may not work for everyone. Shelter staff should consult with shelter residents with disabilities to determine if cot changes or cot location changes are needed. There are no ADA-approved cots. However, some cots are higher and wider than others, have an adjustable height capability, and have higher weight capacities than standard cots. These cots are designed for easier transfer to and from wheelchairs and are generally easier to access for people with mobility impairments. Sometimes cots are easier for people to use when one side is against a wall. This helps to stabilize the cot and acts as a backrest when the person sits up. People with disabilities may need additional space near their cots for things such as durable medical equipment or service animals. Service animals used by people with disabilities must be permitted to accompany their owners in shelters. An accessible outdoor area where service animals can relieve themselves should be designated. It is the responsibility of the animal's owner to ensure appropriate behavior of the animal. People who require power to operate life-sustaining medical devices and motorized mobility equipment should be given priority access to electrical outlets and shelters. Those who require refrigeration to preserve certain medications, such as insulin, should have priority access to those resources. To ensure individuals with communication barriers can communicate with family, friends, and medical professionals, American Sign Language interpreters should be made available as needed, and shelters should be equipped with appropriate communication devices, such as TTYs. If written materials are posted in shelters or distributed to shelter residents, it may be necessary to communicate that information orally to any residents who are blind or have visual impairments. Materials related to recovery resources that are given to the public, such as shelter intake documents or other materials, should be provided in accessible formats such as Braille and large print. A video in American Sign Language could also be prepared in advance to relay information about the shelter in a format that is accessible to people who are deaf. When it is time for shelter residents to return home, it is important to determine if any individuals with disabilities may require temporary accessible housing. This may be necessary if a home's accessible features, such as ramps or electrical systems, have been damaged. By identifying accessible temporary housing options ahead of time, such as accessible hotel rooms, emergency planners can facilitate a smoother transition process for people with disabilities who may not be able to return home right away. Inclusive planning for disaster mitigation and response. Throughout this training, we have emphasized the importance of including people with disabilities and disability organizations in the emergency planning process. It is crucial to coordinate across agencies at the local, regional, and state level to ensure that the functional needs of people with disabilities are adequately met during emergencies. In this section, we would like to give some specific examples of how the emergency planning process can be made more inclusive.
Yeah, generally, we've tried to reach out to as many populations as we could and agencies, from elderly, deaf, blind, with any kind of disability as best we could. Have a very large representation of probably about 20-25 agencies in our group, and that has afforded us a lot of contacts and reaching out actually also to the individuals with disabilities. We met with them each initially, so that we had deaf folks come in, met with them, had some blind folks come in, met with them, developmental disabilities and so forth. And we generally have been meeting once a month of the large group, and that's worked well for us for probably the past 2 years. So, and one of the things that our Red Cross director had mentioned, which I think is great, was that that gives those folks that don't think emergency preparedness a few hours every month to actually go back and think about it. You know, it's kind of on the radar screen off and on, but that kind of forces them to once a month to actually think about that aspect of their whatever their agency does.
To foster interagency coordination and planning, local and state EMAs can reach out to people with disabilities and disability organizations and form functional needs planning committees composed of emergency planners, first responders, community members who have disabilities, and representatives from disability organizations. The Clark County Emergency Management Agency sets a great example of including people from the disability community in the emergency planning process by hosting their Functional Needs Planning Committee, which meets monthly to share information and discuss issues related to emergency preparedness and functional needs.
Part of that is big picture, just the relationships that exist in Clark County already, and the willingness for various political entities to work together. I think a lot of it was the fact that they do see that there is the need and that it affects their agency, and that they were kind of searching, maybe not consciously but subconsciously, looking for some way that they can better and improve the way they're dealing with their community. And we also approached it, we didn't approach it with them, us asking them for help. We pretty much approached it that we want to be able to help you be better prepared. So we weren't asking, we were giving. So I think, you know, that also had a big part of it, that we want to help your community be better prepared. We want to be able to communicate better and like I said, giving rather than asking.
A list of disability-related organizations in the state of Ohio can be found on the resources page for this training, but investigate locally to find other organizations that you could reach out to and invite to be a part of the planning process. Local emergency management agencies may be the coordinating agencies for these planning committees, which should also include representatives from local branches of the American Red Cross.
You know, starting off with meeting with the individual groups, and we also sent them a survey on you know, best ways to communicate with them and things like that. So I'd say, you know, that's one of the key tips is to bring in the individual groups to start with, to meet with them, and totally reinforce your partnership with, I think it's not only emergency management, but it's Red Cross and Health Department, those three key core agencies working together in order to start bringing the group together and to be able to formulate those plans and communication networks and sheltering capabilities. As we reached out, I was very surprised at the people who were very energetic and excited about having the opportunity to be part of the committee. Or just talking with them. The folks that actually have the disabilities were thrilled that we recognized that they were there and that we were interested in hearing what they have to say and not just build a plan in a vacuum, but actually have them come in and give us their input firsthand.
Additionally, it is important to consider the physical accessibility of these planning committees. Follow the guidelines that have been discussed throughout this training to make sure that your meetings are accessible. When you invite individuals to participate in planning meetings, be sure to ask if they require any accommodations to allow them to participate fully. Hold the meetings in locations that are in compliance with ADA building guidelines and make sure that appropriate accessible parking is available. Ask if interpretation services, such as an American Sign Language interpreter, are needed. Be prepared to have materials available in alternative formats, such as electronically, in large print, or in Braille if requested. Also, use person-first language when talking about people who have disabilities. For example, say a person who has autism, not an autistic person. And avoid the use of derogatory terms, such as retarded.
I think it's really important to stress that as you do planning in functional needs, to not assume that you know what the disability community needs. So therefore, it's vital to have those folks with disabilities actually attend the meeting so that when you're going down one road, it's not the wrong road. And they will be able to tell you if you're on track or if you're off track. The problem with that is that it takes a special amount of planning and organizing to make sure that that disability community actually attends the meetings. It's easy for able-bodied folks to jump in a car and drive to a meeting and get there on time. It takes a lot more planning for the disability community to do that. My point is just go out of your way to make sure that you actually get those folks in the room so that they can participate actively during the meeting.
Secondly, engage the disability community in emergency training programs and exercises. People with disabilities who live in the community need to have the same access to community emergency response training opportunities as anyone else. In fact, making sure that people who have functional needs are able to access these trainings will help to ensure that there are strong leaders within the disability community who can assist in disaster response and can help local EMAs and emergency planners understand the unique functional needs that these populations may have.
We've been able to establish so many, I guess, different relationships that a lot of small things, but bits and pieces, which really gives us our partners, the Red Cross and the Health Department, a lot of confidence, and when we do have something, we have the groups we know to reach out to that will help us. We've made the contacts. If I call them at 3 a.m., they know who I am and they're going to pick up the phone. So that's been some of the very key key aspects of the committee.
Ensure that any community emergency training programs, such as the Community Emergency Response Teams program or CERT, are offered in inclusive formats. If your local EMA offers the CERT training, be sure to ask participants if they require any accommodations to allow them to participate fully in the training. Offer the program in accessible locations and in accessible formats, such as in American Sign Language. Actively recruit CERT participants from the disability community. When a CERT training is being offered in your area, let your partners at disability organizations in your community know so that they can share information about the training through their networks. Ensure that people with disabilities feel included and welcome to participate so that they will feel comfortable asking for any needed accommodations.
I'm involved with the Community Emergency Response Team, or CERT, here in Franklin County, Ohio. I'm involved with the community, assisting people all around, both hearing and deaf, in the community. So should something terrible happen, I'm trained and have learned how to help people prepare and lead them through the process. Here in Franklin County, there are over 10,000 deaf individuals. Deaf CERT volunteers provide a huge benefit in assisting the outlying communities and workplaces. So should something happen, an emergency response is not fast enough to start or to arrive, we can help. A person who knows the deaf community in their area, who those people are specifically, can contact them directly. Because if there is no communication, no one knows what's going on, and there is no way to prepare for an emergency. People might communicate through a variety of different means, such as Facebook, email, texting, communicating through print publications, the Deaf Club, advertisements, posters. All of these let people know what's going on. Plus, some areas have interpreter training programs who know the deaf individuals, and they can contact them directly. Deaf Services Center has information that allows them to contact people to let them know what's going on as well. Franklin County EMA contacted Deaf Services Center. They wanted to get this information out to the broader community. So Deaf Services Center is someone who can communicate for Franklin County EMA.
Also, reach out to your local chapters of the American Red Cross and find out if emergency first aid, CPR, and other emergency response training programs offered by the Red Cross are available in accessible formats in your area. Additionally, when planning and carrying out emergency planning exercises that involve people from the community, include people with disabilities. Try to include people with a variety of different types of functional needs and people who do not have functional needs in all emergency planning exercises. Reach out to your disability partners to help you in recruiting participants for these exercises.
Hello, I'm Dr. Susan Haverkamp, Director of the Ohio Disability and Health Program. I want to take a moment to thank you for completing this training. It's important for emergency planners to engage people with disabilities and disability organizations throughout the planning process. By integrating the needs of people with disabilities into emergency planning, we can better meet the needs of others with access and functional needs. Partnering with disability organizations will not only lead to more comprehensive planning, but may provide valuable community resources during an emergency situation. For information about disability organizations and service networks in your community, as well as information for resources mentioned in the training and other valuable resources, please visit our website at go.osu.edu/emergency planners. We hope you feel better equipped to develop and implement emergency plans that meet the needs of Ohioans with disabilities. The work you do is critical to the safety and well-being of our communities, and we thank you for your service.